necessarily the opinions of the owners of Global Communications Network and the operators of this radio station.
Tell me when to go. Good morning. Good morning, everybody. This is the Doctor's Order Show. I am Dr. Marcia Johnson Brown, and we are here live at Global 99.5 FM this morning. Today, we're going to speak about a very relevant topic. It concerns women, and so we are all involved because we all are involved in some woman's life. Today, we're going to talk about cervical cancer. January is Cervical Cancer Awareness Month. And so we want to talk about that because, it's a very important topic. Like I said, especially to women, only women have a cervix. And so it pertains to a woman's body. However, like I said before, we are all connected to some female. We all have some significant female in our lives, and we want to make sure that they stay healthy. We want to make sure that they take care of themselves. And it's always good to have some support when it comes to just, everyday life. So why not in our health? Sometimes we are so busy, time moves away from us so quickly because we are so involved in taking care, especially women, taking care of everybody else that sometimes we neglect ourselves. And in doing so, uh, the results for us may not be a good one. And so today we want to take time out and just talk about this topic and it because it's very, very important. And as we talk about it, you'll understand why I'm saying that we should talk about it and why we need to be cognizant of it and why we need to just go and have ourselves checked out. It's January. I don't know if you had your annual in 2023, but it's January 2024. And so it's a good time to think about it. It's a good time to make plans to have your annual exam done, just to make sure that we don't, miss it or forget about it in 2024. Okay. So today we want to take time out and we want to say to women and to those who love these women to ask them, have they had their annual exams done? Are they ready to make plans to have it done and just go ahead and get it done? Okay, go ahead, call the doctor's office, make the appointment, put it into your schedule, put it on your calendar, and just go and have it done. I know it's a headache. Sometimes we think, oh my goodness. Listen, it's important. It's important. Your health is important. If you're not healthy, if you're not well, you're not going to get all to do all of the other things that you have on your calendar. Those things quickly become a passing thought. So I just want to encourage all women. I want to encourage everyone to go out and get their annual exam. But today we're going to be talking about cervical cancer. So I want to encourage the women in particular this morning. Today on the show, we're going to have a guest. We're going to have a guest who's going to just talk about women's health, but in particular, we're going to talk about, cervical cancer Awareness Month. Um, with us this morning is Dr. Saida Bo. She is a Bahamian. She is the first Bahamian to be enrolled in the International Gynecologic Cancer Society program in collaboration with the University of Miami. Dr. Bo completed a fellowship in gynecologic oncology, gaining experience in managing patients on clinical trials and minimally invasive oncology procedures. In 2022, Dr. Bo successfully passed the IGCS, as I said, the International Gynecological Cancer Society program, and she is now at the Rand Hospital in Freeport, Grand Bahama. So now we're going to bring on Dr. Bo. Good morning, Dr. Bo. How are you this morning?
Good morning. I'm good. How are you doing? Good to see you again.
Good to see you again as well. I'm so happy to that you have agreed to be with us this morning to talk about this issue that is so important all over the world, not only in Nassau, not only in Grand Bahama, not only in Abaco, but all over the world. Um, and so, without further ado, without delay, um, I think we should get started because we know there's a lot to talk about, and time is not always on our side. So, Dr. Bo, if you like, I'd like to ask you about cervical cancer rates. Do you have any statistics that you can share with us, just to give everybody, an overview of how important this is?
Okay, so as I would have shared with you, globally, it is the ninth leading cause of cancer death among women. And, you know, it's even lower, or the number is like fourth in terms of women that are in low and middle income countries. So it is a very big disease. No, it pales in comparison to breast cancer, because I know everybody's always concerned about breast cancer, and we have all been touched by somebody that we know very closely who has been diagnosed with breast cancer. But cervical cancer, whenever I give presentations, to church groups or wherever, it is a preventable disease, right? It is something that we can prevent. Breast cancer, unfortunately, is not always something that we can prevent. Yes, we can ask about family history. Patients can do, risk reducing surgeries and make sure that they have their mammograms, but it's not always something that we can detect early. Cervical cancer is a bit different. It is something that we can detect early if, as you recommend, we go and we get our annual physicals, we get our pap smears, right? And so we're starting the year off. Let's start the year off where we're getting our pap smears, because just bringing it home locally in 2020, according to the National Cancer Registry, there was 20 persons that were diagnosed that year with cervical cancer. And the unfortunate with the COVID pandemic is that there were a lot of women who, no fault of their own, were not getting screened. And, there were women who had, unfortunately, abnormal pap smears, and those were going untreated. They were just there, and the fear of everybody, persons weren't getting treatment. And now these are women that we're finding that are presenting with late stage disease, unfortunately. So, I would encourage everybody, please, 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 see your healthcare provider before the 31st day of this month. If you don't know, it is not the end of the world, but schedule that time. The other time to do it, I tell patients, is your birthday, right? That is your day. treat yourself and get your annual physical. Get your pap smear. I know Dr. Nina Graham in Nassau is doing an initiative where she's offering screening for women at, I think it's $60. I will share that flyer with you, Dr. Johnson, so that you can post. But there is a screening initiative that she is doing in Nassau for women, that they can come and get their pap smears done. So please go get your pap smear, ladies. Please, please, please.
Excellent, excellent. And so, Dr. Bo, as you were saying, um, a pap smear is a part of an annual exam, correct?
Yes.
And
Especially if
so,
the female still has a cervix in place, then yes, a pap smear should be a part of your annual physical, right? That should be something that is being done at the time.
okay.
Some other numbers that I will share. There was a study that Dr. Butler, first Bahamian gynecologic oncologist, did many years ago, looking at our rate of pap smear uptake. And at that time, there was only a 15% rate of persons that were having pap smears performed. And pap smears take 5 minutes, ladies. I know it is uncomfortable, right? But it is a procedure that should only be 5 minutes. So 5 minutes of a discomfort can potentially save your life. And when you get that call, which you may not, to say that your pap smear was abnormal, that does not say, yes, you have cancer. That just says there was an abnormality. And based on that abnormality, we may then recommend further treatment and discuss with you those further treatment options. But again, women should not put their heads in the sand when they get those abnormal results and think that, oh, it's going to go away. It does not, right? It just continues to progress, unfortunately. And so because of the progression, then yes, it leads to cervical cancer. And as you know, cervical cancer is one of those, there's not very many symptoms that women may have, right? So a lot of women can go undetected for years because it's asymptomatic, right? And when women do have symptoms, it's usually in the late stages of the disease.
Okay. So the theme this year for Cervical Cancer Awareness Month is learn, prevent, screen. So that's what we're attempting to do this morning. We're attempting to teach a little bit about cervical cancer, so that those who are not knowledgeable about it can learn about it. And why do we want to learn? Because we want to prevent it. Um, like Dr. Bo says, this is preventable. So if it's preventable, why are we not preventing it? Right? Why are we waiting until these late stages? And the next thing to do is to get out and get screened. Like Dr. Bo said, go out and have your annual exam. A pap smear normally is a part of an annual exam, and that's one of the questions you perhaps want to ask when you call into a doctor's office. Is the pap smear part of the annual exam? Right? And if it isn't, you want to make it known that you in particular would like to have a pap smear done, particularly if you haven't had one for quite a while. You'd be surprised to know that the number of years that go by before women do have pap smears, and time goes by very quickly. So we understand time goes by very quickly, but we want to make everybody aware, because we want you to go out, we want you to get screened, we want you to not progress all the way to cervical cancer. Like Dr. Bo says, there are stages that are detectable before a woman is diagnosed with cervical cancer. So we want to be one of those people, or one of those individuals, or one of those women where you're able to detect, cellular changes before it becomes cancerous. Uh, and so, Dr. Bo, like you said, you can prevent it. What is part of the prevention process
Okay, great question.
for cervical cancer
So
in women?
part of the prevention process is there is an HPV vaccine, right? Because we found that over 90% of persons with this disease is as a result of HPV, which is a sexually transmitted disease, right? Human papilloma virus. Now, no, the HPV vaccine is not the COVID vaccine. I know there's been a lot of vaccine hesitancy. This vaccine is not a new vaccine. The vaccine has been around for quite some time. The vaccine has been around since 2006 when it was first introduced, right? There was two forms of the vaccine, the bivalent vaccine and the quadrivalent vaccine. The vaccine has undergone a number of changes over the years. In the Bahamas locally, right? July of this year will make 10 years since we've actually had the vaccine available locally. When it initially was made available locally, it was a vaccine that persons had to pay for. The vaccine now is free of charge. Okay, you can go to any of the local community clinics and get vaccinated. There are three shots in the vaccine series. The vaccine is recommended for persons between the ages of 9 to 45. That was something that came about in 2019. The FDA increased the age of approval to the age of 45. So, women up to the age of 45 can still receive the vaccine. Ideally, yes, it should be given to persons before they're sexually active so that it has the most efficacy. But right now, I mean, trying to prevent, we will give it to anybody once they present themselves. Then, yes, you should be getting the vaccine.
Okay, so you're giving the upper age of 45, but then you said you would give it to anyone. Is that so?
So,
Would you give it to
sorry, I
someone
should
older
not,
than
let me
45?
qualify that. So, when I say up to any, or give it to anyone, there are also studies looking at the use of the vaccine in women that have an abnormal pap smear, right? So, even if a patient has an abnormal pap smear, we give the vaccine for whatever it is worth. There has been some studies showing that there is some benefit to these patients. So yes, at this point, you're trying to do everything to save that lady's life and make sure that she does not progress to cancer. So yes, it would be given. But it's not okay, you don't have an abnormal pap smear that we would give you the vaccine. No. Generally, we give it to the age of 45. And yes, it is also available or recommended for males as well. So it's not just for females because, as I said, it is sexually transmitted. So there is no point in just vaccinating the female if the male partner is not also receiving the vaccine.
Okay, all right. So excellent points, Dr. Bo. In particular, because we know that because of our economy, in part due to Dorian and also COVID 19, um, it's good to know that we can go to our local community clinics and we can get the HPV vaccine for free.
Yes,
That's
ma'am.
a that's a point that I think is extremely important at this point. Um, because we don't want anybody to be missed out, especially because they don't have financial means to get it. It is available for free. Everyone, and I'm stressing that because we just want you to be well. We want you to be healthy. Okay? Yes, we know that the wait time basically may be a little bit longer, but if what's a couple of minutes to save your life, to make sure that you're healthy. All right. So the first thing females we want to do is we want to get screened. Yes, we want to go in, we want to have our annual exam, which includes a pap smear, and we want to get that done. Okay. So first we're learning. That's what we're doing now. We're learning. We want to get everybody screened. Everybody who is sexually active should have a pap smear. Should have a pap smear done. Another question, Dr. Bo. Uh, Persons who are not sexually who are not having sex, should they have a pap smear done?
So that question, you have to ask, have they engaged in sexual activity before? Because if this is a patient who has previously engaged in sexual activity, then yes, you should still get a pap smear, because the HPV virus can hang around for quite some time, right? So, which is why I would recommend that once you've had sex before, yes, you should get screened. Now, in that population that have never had intercourse, your virginal population, then no, the screening would not be of any benefit in these persons. But there's that caveat, right? And in medicine, there's always a caveat to something, or a but, right? In that 90% are related to HPV, which is sexually transmitted. There are those rare, weird, and wonderfuls that have nothing to do with HPV. They are HPV independent, right? And so those ones would be detected based on a pap smear. Those are the patients that, yes, hopefully should have a pap smear. But again, do you want to encourage a patient to have a pap smear who's virginal? Well, you can, because now there is what we call self testing for HPV, along with, you kind of just do the kits where you swab at the introitus, and if there's anything, it will not pick up those other strains, but there may be something there that we can find. So it is a speak with your provider kind of situation. Like, that has to be a decision that you jointly make with your provider, that, okay, there are no risk factors, there's nothing of concern, and so therefore we won't go ahead and do the pap smear. But now, if there is concern, then the provider may opt to doing a pap smear. But if you've had sexual activity before, then definitely yes, you need to still proceed with your pap smears.
Okay. And so once again, this is the importance of having, a physician who you feel comfortable talking with, and whom you can build a relationship with, and just feel comfortable with, because like you said, there's always these caveats. Yes, there are the general rules, and yeah, we can go with general, but every patient is different, and every patient is special, and so it's important. You're just not going to go there and say, "Oh, I need a pap smear," and not give a good history, and not give the doctor everything they need to work with to make the best decisions for you. Correct?
Correct.
Yes.
Because, we both know patients don't read the textbook, right? So the things that the textbook would say that the patient should present with, they don't always do that, right? So because of that, you have to kind of, yes, be open and honest, and not think that the physician is trying to get in your business, because no, that's never the intention. It is just to kind of being able to put everything together and treat you in the appropriate manner.
Okay, so that's excellent. Um, I want to highlight what we just went over, in that, yes, if you have had sex, if you have had one encounter of vaginal intercourse, you need to have a pap smear done. Sometimes patients will say, no, I really don't have sex, or I had sex maybe 5 years ago. And so no matter when, you need a pap smear, because like Dr. Bo just said, it hangs around for a long time. It can persist for a long time, and so you want to make sure that you get it done, no matter how many the time that has passed in between your sexual encounters, your vaginal sexual encounters. Okay, so you want to get screened. That's your pap smear, and you want to, like we just mentioned, give a very good history, so your doctor can make a good decision, and you should be a part of the process as well, so that you can have the best outcome possible. All right, so Go ahead, get your pap smears done, your annual exams done, and then you can go on from there. So, Dr. Bo, very good overview of who should have pap smears done. Um, and Dr. Bo, one other question: is there an age when pap smear should no longer be done?
The recommendations, as per the United States Preventative Task Force Services, is up to the age of 65. Again, there is a little footnote, an addendum to that. You stop at the age of 65 in women who have had regular screenings. So, not somebody who had a pap smear, hasn't had a pap smear in 15 years, right? And now they're approaching 65. No, that's not what that recommendation is for. It is you've had your regular pap smears and your last three pap smears were negative. Then, yes, at the age of 65, the recommendation is that those patients can then discontinue from screening. But because a lot of our patients don't get screened regularly, then most times we would continue doing pap smears even beyond the age of 65. But you have that relationship with your provider. You know, you're seeing your family physician and they're doing your pap smears and you're coming up on the age of 65. Then again, you can have that conversation and saying, okay, I think we can stop the pap smears now at this point because you've had negative pap smears for the last several years. And so we can discontinue because at this point, there should be nothing new that is showing up. But if you've not had regular pap smears or you had an abnormal one within that time period, then you'd want to continue beyond that age of 65.
Okay, so we'll take a break right now, everyone. We're talking about cervical cancer here on the Doctor's Order Show, live on 99.5 FM. Uh, Today, our sponsor is LiveWell Pharmacy. LiveWell Pharmacy focuses on patient well-being through education, inspiration, and coaching, and they strive to simplify the patient's life by offering different convenient services. You can reach them on 805-0557, which is their WhatsApp number. You can also WhatsApp in your prescriptions so that the wait time when you get there is zero. They are located in Solomon Springs Plaza on Prince Charles Drive, and they are open from Women Care Reproductive and Diagnostic Center is located on number 33 Marathon Road. Their number is 325-8850. They specialize in all of your obstetrical and gynecological needs. So if you're needing birth control, you can go and see them. If you're having heavy periods, you can go and see them. If you plan to get pregnant, they can provide all of your antenatal care, and they can also provide your obstetrical care or while you're pregnant, all of the care that you need. Okay, so check them out, Women Care Reproductive and Diagnostic Center, number 33 Marathon Road. Their number is 325-8850. We'll see you right after the break. Yeah, I'll call you back. Okay. Welcome back, everybody. This is the Doctor's Orders Show, and this is the call-in show. So, if you have any questions, please do not hesitate. Give us a call on 326-0271 or 326-0272. You can also WhatsApp us on 801-0271. You can also listen to us on cable 974 on the Cable Bahamas channel 974. We're also on YouTube and on Facebook on the Global 99.5 page. So today we're talking about cervical cancer, and we have our guest, Dr. Saida Bo. She's a gynecological oncologist, and she's here to answer any questions or clarify any queries that you may have about female issues. So if you're having any questions, please do not hesitate to call in. Give us a call. Like I said, 326-0271, 326-0272, or 801-271. Okay, so we're back from our break, and we're going to continue with Dr. Bo. Dr. Bo, are you still there?
Yes, I am.
Okay, very good. Um, Now, in terms of prevention, we're still on prevention. We talked about taking the HPV. We talked about screening. Is there anything else that can, prevent cervical cancer?
Really, vaccine, regular pap smears, right? There is nothing that you can take in terms of medication. If you have an abnormal pap smear, we will recommend maybe proceeding with a colposcopy. Well, we normally recommend proceeding with a colposcopy because the pap smear is only just that, as you said, a screening test. So the colposcopy would then be further definitive as to what exactly is going on. And then after the results of the colposcopy, there may be recommendations for a cryotherapy or a cone biopsy, laser procedure. But again, all of those will be based on what are your results at the time after your colposcopy has been performed. Just to go back 1 second, we spoke about the pap smear initiative that Dr. Nina Graham is doing in Nassau. I found the flyer. It is $60, and it is between the dates of January 22nd to the 27th, right? It's a pap party week, is what she's calling it. So, check them out, please. Get your pap smears, women. $60 is fairly reasonable cost to get a pap smear in this country. So make sure that you get your pap smear, get screened during that week, please.
Okay, very good. So that's Dr. Nina Graham. Like you said, January 22nd to the 27th is her
Yes.
pap smear party, and the cost is $60. Yes?
Yes, ma'am.
So that covers a part of our preventive care. That's here in
Yes.
Nassau. And we have all of the other family medicine physicians as well who are able to provide that service for you as well, any time of the year. But January being the focus, you want to start off well. We want to take advantage of that, okay? We're encouraging everybody to do it. Now, Dr. Bo, one question. The
Hold on, and it
vaccine,
is covered by
uh,
NHI.
okay,
So,
so you don't even
those of
have to pay
us
that
who,
$50.
right. So, those of us who have signed up with NHI and you have your NHI provider, pap
Yes,
smear is a part of your routine annual. So, you can go and get your pap smear done.
yes,
Sorry, you
ma'am.
were going to ask me a question.
Yes. You talked about the HPV vaccine, and I think you said that you can start that at the age of 9.
Yes, ma'am.
Now, we know that most girls at 9 are not sexually active. So why are we starting it at 9?
So that's why we started at 9, right? So the recommendation is 9, but locally we actually started at 11. So that it is in the school health system. A lot of the school health nurses do send home letters to parents seeking permission, consent for their child to receive the vaccine. And so you started at 9 because, yes, they're not sexually active and you want to get the series completed before sexual debut when the vaccine would be able to have its maximum effect, right? So you get the vaccine, the 3 shots of the vaccine, and then you should not have anything to worry about. But one question that I know a lot of people sometimes ask is, so I've been vaccinated, do I still need to get a pap smear? Yes, you still need to get a pap smear even though you've been vaccinated because there are those cancers that may not be HPV dependent. But yes, you still need to get your pap smears.
Excellent. Okay. So you want to start before the sexual debut, and
Definitely.
yeah, you want to, like you said, routine um, delivery of the vaccine is from 9 to 45. However, if there are other things present, we can go even beyond the age of 45.
Yes,
Yeah.
ma'am.
Okay. So the HPV, the human papilloma virus, is a sexually transmitted infection. Is that correct?
Yes, ma'am. So, you know, we're talking about cervical cancer awareness month, and that's where most of my focus is. But the HPV virus does not just cause cervical cancer, right? It can cause head and neck, it can cause anal, vulva, uh, can get throat cancers as a result of the HPV virus, right? So, vaccinating yourself, your child to the HPV is not just preventing cervical cancer because, a female may say, well, I have a boy, so why do I need to vaccinate him? Well, more than one reason because there's other forms or there's other cancers that can result from HPV. One, two, I like to say that you are now giving your future daughter in law the best wedding present possible because if you now vaccinate your son, you will be able to sleep at night, hopefully saying that, okay, I've protected her from something that can then harm her. I've also protected my son because I think no male wants to know that your wife has now been diagnosed with a cancer. No, HPV does not have his name on it. It does not say that she got it as a result of having intercourse with him, but it is a sexually transmitted infection. And then knowing that, okay, my wife now has to deal with cancer treatment and all of those things. No male would want to know that. So now, if we all get vaccinated, that would be one less thing that I think a lot of people would be able.
Okay. So this virus can affect males as well.
Yes, ma'am.
Yes, they can affect males, and so it is important for everybody to be on board with this the vaccination process and with the knowledge, because knowledge is power. This is how we're going to prevent, and prevention is better than cure. And
Yes,
so
ma'am.
we want to encourage everybody, even if, yes, we're talking about cervical cancer awareness month, but it also includes everybody because, like I said, everybody is connected to some female. Uh, we have mothers, we have brothers, we have, sorry, mothers, we have sisters, we have aunts, the whole gamut of women around us. We want to make sure that they are okay. And males, you want to get vaccinated as well because you can also, prevent in the transmission of this virus as well. So Dr. Bo is here educating us. She's teaching us. She's helping to prevent, and she's teaching us about the screening process of it all. And like it was said by Dr. Bo, this HPV virus does not only infect the cervix. I mean, this HPV virus is also how we get warts, the everyday warts that we see, on our hands or anywhere else on our bodies. Um, and so this virus is responsible for warts and other lesions and also cervical cancer. Okay, so everybody, listen up. Let's get the knowledge that we need so that then we can stay healthy. Okay. Uh, Now, yeah. So, like Dr. Bo was saying, this cancer is more prevalent in lower income or middle income countries. And once again, the cancer is not easily or is detected, mostly um, when symptoms have occurred. And of course, we know that's too late. We never want to detect something when we start having symptoms. We always try to prevent that. That's why, cancer screening is so important. This is why your annual exams are so important. We want to we want to just be on top of things. We do not want to be, chasing fires when so much damage is already done. Okay, so we talked about prevention, and that's where we want to stick with because prevention is key. We want to get to things before it progresses. We don't want to get there. But um, like Dr. Bo had said before, even if we get to, if we progress to cancer, there are treatments available. And Dr. Bo, I know we went over it quickly, but can you just go over it again for us, please?
Sure. So, in terms of, you know, there is the pap smear. That's the initial step that every woman takes. After the pap smear, then we progress to colposcopy. Colposcopy is a little bit more involved. There's more discomfort associated with colposcopy. It's now using a colposcope, which is almost like that of a microscope, to look at the cervix and look at any abnormal areas on the cervix, and then taking a biopsy from those areas. And so, yes, there is somewhat of a discomfort associated with that. And once we would have done that, that is then sent on to our pathology colleagues who, look at everything, and they then come back and tell us whether it is CIN 1, 2, or 3. So, what is CIN? CIN is cervical intraepithelial neoplasia, and it is graded 1, 2, or 3, looking at the depth and the level that is involved, right? CIN 1 is the least worrisome of the three. So, a patient with a CIN 1 diagnosis, the provider can recommend certain treatment options, or to have based on what was the initial pap smear, may recommend again just to repeat the pap smear in 6 months to a year, or may offer some form of treatment at that time. But again, this would be based on each individual patient. CIN2 or 3, those are a little bit more aggressive. There's a greater chance of these ones leading, especially CIN3, then leading to cancer if it is not treated. So, you want to know that, okay, there was a diagnosis of CIN3, what treatment is going to be offered? And so, depending on your reproductive desires, if it is that the female has not had any children or she's completed having children, the physician may then tailor their decision based on the female's reproductive desires and what she wishes for. So we'll then proceed from there. But if it is that unfortunately your pap smear shows cervical cancer, which on occasion the pap smear may come back with a diagnosis of cancer, then that then sends you directly to the gynecologic oncologist, who would then do further investigations to now try and assist with staging. And based on if it is an early stage disease and the size of the lesion, patient may just be offered surgery. If it is too large of a size, then the recommendation very well would be chemo and radiation treatment. Chemo and radiation is somewhat of a costly venture, right? But it is the recommendation, it is the gold standard for managing patients with a more advanced stage disease. And persons who may have an early stage, but the size of the disease is larger than that for what we can safely do surgery for.
Okay. All right. We're going to go to a break. And before we do that, we just want to mention our sponsors for today. Our sponsors today are Live Well Pharmacy, where they focus on patient well being through education, inspiration, and coaching. At Live Well Pharmacy, they strive to simplify the patient's life by offering different convenient services. You can call them on 805-0557, which is also their WhatsApp number, where you can text in your prescriptions that you require from them, and they can give you a time to come and pick up your meds so that you're not there just waiting around. You can be at home or wherever, or doing whatever else you need to do, and they'll give you a time to come in and pick up your medicine. They're located in Solomon Springs Plaza on Prince Charles Drive, and their hours are 8:30 a.m. to 8:30 p.m. Monday through Saturday. Women Care Reproductive and Diagnostic Center is located on number 33 Marathon Road. Their numbers are 325-8850. They specialize in annual exams, pap smears, all of your obstetrical needs. If you're trying to get pregnant, they can help you do that. If you do not want to get pregnant, they can help you do that. All right. And also, if you are pregnant, they can take you through the process to delivery for your little one. So give them a call. Women Care, Reproductive and Diagnostic Care, Diagnostic Center on number 3 Marathon Road, 325-8850. We're going to a break and we'll see you when we get back. Welcome back, everybody. Welcome back. We are talking about cervical cancer. We're talking about HPV. We're talking about pap smears. We're talking about HPV vaccinations and the likes. We have Dr. Saida Bo. She's here as a guest on our show today. She's in Freeport, Grand Bahama, and she's a gynecologic oncologist, and she's helping us to learn more about, the HPV virus and also the vaccine and, what it does in the body. I just want to take us a little bit now from cervical cancer and move on to some of the other things that Dr. Bo educated us about. So HPV doesn't only affect the cervix. Um, we also learned that HPV also can affect the oral cavity, the throat. Okay, we have a caller on the line, so we're gonna just take the call right now. Hello, this is the doctor's orders on Global 99.5.
Hi, good morning. How are you all?
Good morning. We are well, and you?
Well, thank you.
Good.
So I just wanted to get some general information. I've been following, and I think I'm aware of what it is that has been said. But for the lay person who may be a little confused about some words that are used or even timelines, can you speak to, or can the doctor elaborate more on just the simple steps or signs that a person may experience that can actually save their life in early detection?
Okay, Dr. Bo.
Okay, great question. So no, we did not talk about the symptoms that women can have with cervical cancer. So one of the things is that it's asymptomatic. Women may not have any symptoms. That's usually the common presenting complaint, that they didn't know, they didn't have any symptoms. But women can also present with weight loss, unexplained weight loss. So you're not on a diet, you've not changed, you've not started exercising, unexplained weight loss. They may notice that they are having bleeding after intercourse, right? So if it is that a female is seeing bleeding after intercourse, there is cause for concern. If the female is finding that she is having a discharge that does not seem to go away, a foul smelling discharge, that is also cause for concern. So those are things that normally patients would present with who would have cervical cancer. The other thing that a female can present with is urinary incontinence, meaning that these would be women who just find that they're always leaking, they're always wet, right? So they cannot control their bladder for whatever reason, and so these are patients that should seek medical attention and be concerned. It's not something that you would want to just brush away or try to explain away, but you should seek medical attention.
Hello, call. Are you still there? Okay. I hope that answers your question, caller. Thank you for calling in. All right. So those are some of the symptoms that females can look into. Uh, if you're experiencing any of those things, like Dr. Bo says, sometimes you may experience no symptoms at all. You may be asymptomatic. Another one is weight loss, unexplained weight loss. Okay. We'll get back to this list. We have another caller on the line. Hi, caller. Are you there?
Yes, I'm here.
Okay. You can go ahead.
Okay, what I heard was Dr. Bo said women generally can't stop their pap smear at age 65 if they've had
Excellent question, Dr. Bo. Did you hear the question?
Yes, excellent question. I heard the question. So those women who have had a hysterectomy and the indication was not for a pre-invasive disease of the cervix and their pap smears before were negative, then no, those women do not need what we would call a vault smear, because the pap smear is actually what is done when a female has a cervix still in place. But after she would have had a hysterectomy and her cervix would have been removed, then yes, those patients, as long as it's not for anything to do with their cervix, that they didn't have any pathology or an abnormal pap smear before, then once they would have had the hysterectomy, they can discontinue screenings in terms of having the pap smears. Now, something to bear in mind, and I want to try and take a second to educate everybody on, when a provider puts a speculum inside of the vagina, it is not always that we are doing a pap smear. Sometimes we are just taking a look and looking at what's going on the inside of the vagina. It's not saying that there is a pap smear. A pap smear is an actual procedure that has to be done. So just want to educate everybody on that, because I've seen patients before who would say, "Oh, I had a pap smear a month ago with another doctor," and then you look and there's nothing. And if it is a system where you can actually access those previous notes, you would see that they just kind of did a speculum examination and there was not a pap smear. But just to educate persons that a speculum examination is different from, or is not meaning that a pap smear has to be performed at every time. So even after a hysterectomy, a female can still have speculum examinations just to ensure that there is nothing going on within the vagina itself after she's had her hysterectomy.
Call is left. Okay. All right. Thank you. Thank you, Dr. Bo. Those were excellent questions. Thank you, callers, for calling in. And so just want to summarize this in terms of symptoms once again. Just for anybody that may be experiencing anything like this, to go in and have a pap smear done. Okay, so if you're asymptomatic, a lot of people are asymptomatic, so let's not take for granted that because I don't have any symptoms that there's nothing going on. You still need to check. Unexplained weight loss, you need to go in and find out what's going on. If you have bleeding after sexual intercourse, yes, definitely you need to go. If you're having some vaginal discharge, if it's foul smelling, any abnormal um, vaginal discharge, you need to go and get checked out. Urinary incontinence, for example, you just can't hold in your pee. You're laughing, you're coughing, and you're wetting yourself, or you just find yourself wet all the time. You need to go in and find out what's going on. Uh, you know, these are some of the symptoms, and these are not specific to anything. But if you're experiencing anything of this type of symptoms, if you're having any kind of symptoms like this, you need to go into your doctor and you need to find out what's going on, because these are not normal. These are not normal. Okay. Thank you, Dr. Bull, for highlighting those things for us as well. Ladies and gentlemen, we are at the end of our program for today. We want to thank Dr. Bo. She was so excellent in helping us. She's a gynecologic oncologist. She's available in Freeport, Grand Bahama. We also have two more gynecological oncologists. That's Dr. Raleigh Butler, and then there's Dr. Halliday as well. They are located in Nassau, Bahamas. And so I just want to encourage all ladies, everybody, like Dr. Bo said, needs to go and have their annual exam done. It's so important. It gives us so much information. So many things can be prevented before it gets to a stage where nothing else can be done. And so I just want to encourage everybody today to be well. I want to encourage us to go out there and take care of ourselves. I want you to know that we have so many physicians in the Bahamas who's able to provide excellent care and service for you. I want you to build a relationship with one of them today. Yes, we have the NHI system where we're able to access care. We also have the public hospitals, the public clinics where we're able to access care. We also have our private physicians where we're able to do that as well. Please go out, find somebody today if you're having any issues. And even if you aren't, please schedule your annual exam and so that you can feel confident moving through 2024. Once again, thank you, Dr. Saida Bo. It's been a pleasure, and you have been so enlightening in all of it. Thank you so much.
Thank you
This
too
is
for
the
having
doctor.
me.
You're more than welcome. You're more than welcome. This is the Doctor's Orders Show, and we'll see you again next week, Tuesday at 11 a.m. Thank you.
You've been listening to the Doctor's Orders with Dr. Marcia Jonathan Brown on the Global Network, 99.5 FM.